Hello, and welcome to the new Hire Nurse Seminar and Training Session. In today's complex and ever-changing healthcare environment, the ability to measure and improve the quality of nursing care is essential to ensuring patient safety and achieving optimal outcomes. As explained by B. O'Nair, Zengel, N. O'Nair, Ivankova, and Patrician in 2021, analyzing data trends and comparing organizational performance to national benchmarks helps healthcare facilities identify areas for improvement and implement evidence-based strategies to enhance care delivery. Nursing-sensitive quality indicators can be measured by patient and nurse satisfaction scores and adverse event or near-miss reports. Specific examples include patient falls with injury, pressure ulcer rates, pain assessments and outcomes of interventions, nosocomial infections, and restraint prevalence. This tutorial will focus specifically on patient falls with injury, exploring its significance as a quality indicator, its impact on patient outcomes and healthcare costs, and the critical role nurses, particularly new nurses, play in fall prevention and accurate event reporting. The National Database for Nursing Sensitive Quality Indicators, or NDNQI, is an important source of information used to highlight the effectiveness of direct nursing interventions on patient care by a particular facility or unit and organized by adverse event categories. These databases are comprised of reports related to nursing processes, organizational structures, and patient outcomes. It also provides some information regarding best practices and the cost to achieve certain results. The NDQNI was established by the American Nurses Association, or ANA, and is used for purposes including but not limited to comparing a single organization's performance against national standards, thus identifying areas for improvement. This supports evidence-based decision-making in nursing to help improve patient safety and care quality. In the year 2020, researchers Rom, Whiteman, Swanson-Bierman, and Stevens wrote a report about how areas of improvement are addressed, and when data trends in a positive direction, the organization has a higher potential of reaching magnet status, which recognizes healthcare facilities for nursing excellence. An estimate of up to 1 million hospitalized patients sustain falls annually in the United States. Falls can result in serious injuries such as bone fractures, head trauma, and internal bleeding. These injuries can cause prolonged immobility and lead to permanent disability or even death. Injured patients often require extended hospital stays, increasing their risk of complications like infections, pressure injuries, or hospital readmission. Falls with injury drive up healthcare costs due to additional treatments, testing and imaging, surgeries, and/or rehabilitation. As described by researchers Rom, Whiteman, Swanson-Bierman, and Stevens in their 2020 research report, these treatments are often not reimbursed by Medicare or insurers under never events policies. Substantial evidence demonstrates nurse residency programs that are developed specifically to educate new nurses on a variety of subjects, including nursing sensitive quality indicators, improve individualized nurse outcomes such as retention, satisfaction, and competence. Retaining staff that is adequately trained, knowledgeable, and motivated will positively influence patient quality of care, as suggested by T.R. Webb in his 2023 scholarly article. An interview was conducted with Vicki Zano, RN, BSN, OCN on May 2, 2025. Vicki is a hardworking and dedicated nurse manager and oversees a 36-bed inpatient medical surgical oncology unit in Plainsboro, New Jersey. When it comes to self-reporting adverse or near-miss events, Vicki admitted there are many benefits and simultaneous challenges to collecting accurate data. Once a problem is identified on her unit, such as an increase in reported patient falls with injury, an evaluation of nursing-sensitive quality indicators must be prioritized. Her strategies to combat and increase prevalence of adverse events, such as patient falls with injury, coincides with the research conducted by Rahm Whiteman, Swanson Bierman, and Stevens in 2020, with a suggested structure of plan, do, study, act. Contributing factors must be analyzed and interventions developed. As a nurse leader, Vicki leads by example and emphasizes thorough assessments and consistency. Nursing communication, interventions, and responses to patients who are at a high risk for falls in the hospital are closely monitored, and adverse event report data is reevaluated after a length of time. If the accumulated data proves the outcome is preferable, Vicki will educate her staff during monthly staff meetings on the improving nursing-sensitive quality indicators, focusing on progress and again emphasizing consistency of thorough fall risk assessments and fall prevention strategies and interventions, such as bed and chair alarms, non-slip socks, hourly rounding focused on toileting, and Avasure virtual monitoring systems. Her Hospital of Employment also sends out weekly reports regarding quality indicators and best practice updates to every staff member via their employee email. So how can you directly impact research and best practices? Bedside nurses and other members of the interdisciplinary team have a duty to accurately report adverse and near-miss events that occurred under their responsibility. Vicki and her staff use a program separate from the patient's EMR called MIDAS. Though information extracted from MIDAS reports are meant to solely be utilized for research to improve and advance clinical practice, Vicki explained that staff members are often hesitant to complete the report out of fear of punishment and consequences. She acknowledged that the reporting nurse has opportunities to exaggerate or minimize the facts of an event, which skews the accuracy of the data. She also admitted that filling out MIDAS reports is a tedious and time-consuming task, and her busy nurses will often prioritize direct patient care over filling out and filing the reports. In conclusion, patient falls with injury represent a significant nursing-sensitive quality indicator that directly reflects the quality and safety of nursing care in healthcare settings. Monitoring, responding to, and accurately reporting these events not only protects patients from preventable harm, but also reduces healthcare costs and improves overall patient outcomes. Through tools like the NDNQI, nurse leaders and frontline staff can identify patterns, implement targeted interventions, and evaluate progress using reported event data. As demonstrated through both research and the insights of experienced nurse leaders like Vicki Zaino, success in fall prevention requires a culture of accountability through accurate reporting and consistent application of best practices. It is especially important for new nurses to understand the implications of nursing-sensitive indicators and to be actively engaged in efforts to reduce patient falls with injury. By fostering awareness and education, healthcare organizations can continuously improve patient care and move toward achieving excellence in nursing practice. Thank you.